Hey YouTube, I've been longing to update a video, and I'm sorry it took long, and I should have recorded throughout these days that I've been going through my issues since I got discharged from the hospital. Honestly, the only issues that I've really had is I'm recording from my phone and from the face camera, so it was kind of weird. Um, Hunger. I'm hungry. I know I've looked on. I looked up different YouTube users, different gastric bypass patients or whatnot, and a lot of people. I'm talking about a lot of people are not hungry when they leave the hospital or post-op. I don't know when they start getting hungry again, but I was hungry on my second day post-op, and I was like, okay, this might be head hunger. I'm not used to it, and no, this was hunger pains. My stomach was growling, and it was definitely hunger. So then my clear liquid diet consists of on the hour, every hour, drinking and 4 ounces of either cranberry juice, either Crystal Light, either Gatorade. My protein, my liquid protein, I have to incorporate at least 6 tablespoons of that, and then work my way up to 8 tablespoons, which is disgusting. It has a horrible taste. And broth. Broth at least 3 times a day, 6 ounces. And the broth is supposed to do it for you, and it wasn't doing it for me. And I'm a week post-op. Well, actually, tomorrow. Well, technically today. But because it's about 12 something in the morning. The hunger in the last couple of days was very achy, and then that causes me to have head hunger at the same time, so I try to ignore it. And so then I said, you know what, Mocha, what are you doing? Come here. So then I just said, okay, what's going on here? Is this normal? So I started doing my research. Sorry, excuse me. I started to do my research, and there was another YouTube gastric bypass patient that basically said that they were going through going through the same thing, and suggested another type of broth. And I gotta be careful because every doctor, from what I've seen here, is different. So every doctor's different. You guys could eat purees after a certain amount of days, after a certain amount of weeks. My doctor strictly has a clear liquid diet for at least 10 days. So what I did was that I basically called the nutritionist yesterday, and I told her that I'm having these hunger pains. That it's very uncomfortable. That's it. Is it normal? She said yes, but to continue with the diet, my appointment is tomorrow, thank God. Let's see what I can incorporate to this clear liquid diet. And basically, she said that she'll see how she'll incorporate some pudding. I'm like, I was really hoping for I was really hoping she would say maybe we can start you, since you're doing good, maybe we can start you on some purees. No, she said pudding. I said, you know what? Let's do it. Because the Gatorade is not doing it. The Jello's not doing it. I swear to God, everywhere in the house there's Gatorade. There's, let's see, everywhere. You see the apple juice? There's apple juice, there's Gatorade. I've been doing the breathing exercise. That's to calm me down, really. Honest, that's what I use it for. I forgot what the medical freaking reason was for that. Well, I did lose some weight. Who wouldn't on a clear liquid diet? So, my weigh-in, I don't know if you guys know, my weigh-in was 288 pounds. 288.4 pounds. Okay. Now, a lot of people are on a 3-week or 30-day liquid diet before pre-op, but not Jose Sosa's patients. Not here in Florida, at least in Miami, Florida. You're only required to do 48 hours of a clear liquid diet before surgery. So all I did was 48 hours of clear liquid diet. So I highly doubt, the most that I can lose on a clear liquid diet was in 2 days. It's probably 2 pounds of 2 pounds. So I'm just going to say that. And, so 288 is my starting weight. And I am at 273 today, December 12th. My surgery date was December 5th. So that's 1 week post-op, and I'm down 15 pounds. So I guess that's good. That's normal, because considering that I am only 125 pounds overweight, I am not, considering the fact that I'm 125 pounds overweight. Most people on here that lose more in that first week are a lot more overweight than I am. So I'm considering that factor. And, well, what else do I have to tell you? Other than the fact that I was having hunger pains, other than the fact that being hungry makes it that much hard. Because this week, and I'm like, fine. I'm here counting ounces, I'm doing everything, and I know that I didn't think it was going to be hard. I said, because, mind you, I was under the impression I wasn't going to be hungry. And, so I put an alarm on my phone for every hour on the hour to go off. Physically, I'm good. Like, when I drink the broth, everything goes down. I think, honestly, I'm doing really, really good. And, sleeping at night, it's uncomfortable. Super uncomfortable. It's so uncomfortable that I've ruined my sleep pattern. My sleep routine. Sleeping at night. I don't sleep at night anymore. I usually push it until I can't no more. And then when I look at the time, it's already 3, 4, 5 in the morning. People are already getting up to go to work while I'm already trying to fall asleep because I'm so uncomfortable. Because I'm not used to sleeping, sleeping on my back. I usually either sleep on my side. Well, honestly, I sleep on my tummy mostly than my side. So, you people who sleep on your sides, it's good. That's an advantage, because sooner or later you're able to do it, but I don't. So, I have to sleep on my back, and decisions ache like a normal pain. Like if you would to have a lot of people on here like, oh my god, the pain is so unbearable. Oh my god, I didn't feel that. Like, I didn't even feel that with my appendix. I'm like, okay, it's there. It's just a little sore. That's all you're gonna feel. It's not excruciating. And I never understood. I see people on here, and they're like, they explain the incisions. They explain the actual incisions to be excruciating. Well, maybe to them, but it's normal to me. Surgery. You're just healing, and if you like cough or sneeze, then yes, if it pulls, it hurts. But it is uncomfortable. And I have been sleeping on my back. So, my time is almost up. I don't know what more do you want to know. Any questions, concerns, feel free to ask. Please subscribe. Let me know what's going on. Any feedback will be good.